Moving on to a extremely exciting announcement. Well, it's a combination. It's an announcement and a discussion, of course. And we've all heard of Mayo Clinic. And their dedication and leadership in healthcare, let alone digital health, is unwavering. They may have had a significant announcement that came out this morning about a partnership with Everyday Health. And we have two incredible people here to talk about it, led by our keynote speaker, Dr. Philip Hagan. And you guys are mic'd. I can see you over here a little bit. And so I wanted to give you, check out his bio, OMG. He's done an incredible amount of amazing stuff. And I have a fun fact about him, and it requires a bump at the end. His clinic was named after a condiment. Ha ha. Okay.
Thank you.
Thank you.
Well, thanks for having us and allowing us to end the day. They picked a gray-haired guy to come down from Mayo so that I could talk about the 120-year history of Mayo Clinic and the last 20 years, which have been our digital years, and try to run through that fast enough so that we can talk about what we're really excited about, which is, yeah, thank you. What we're working on in the mobile world to get the right information into the right hands at the right time so people can take care of their health. Well, this is an overview of what I'm going to be talking about today, a little bit of background, quick health landscape, and then where we are going at Mayo Clinic. We've been around for a long time, 150 years. The main point I want to make is these guys here, you can barely see them, but that's Will and Charlie Mayo. They were bright guys and outstanding surgeons, but three pieces of brilliance that I like most about them were, number one, they said, even though we're outstanding surgeons, we have a lot of patients coming here that don't have surgical problems. So we need to get smart people together who can work in a collegial way around the needs of the patient. And they accomplished that about 100 years ago when they built the first multi-specialty group practice of medicine. And the real key piece to that was integration. The second flash of brilliance, which also happened about 80, 90 years ago, was the creation of something called the unit patient record. And so when a patient came to Mayo Clinic, and that building you can sort of see there was one of the early Mayo Clinic buildings built in the late 20s, was that the medical record, on paper of course at that time, went around with the patient wherever they went. So that when they went to see me as a generalist, we had the paper record. When they went to see the cardiologist had the same paper record. When the patient went into the hospital to have a hip replacement, they had the same paper record. And so this unit paper record was really amazingly revolutionary at the time and served us well enough so that we really didn't start looking at electronic medical records until 1994 when we started looking at the electronic medical record. So what I think we're circling back to in the digital world is figuring out how we take this cloud of information, this huge amount of data that you all have been talking about, and turn it back into a unit record for the individual. All right, well, let me move on here. The third flash of brilliance that these guys had was they saw the importance of prevention back in the late 1920s and early 1930s. So Will Mayo said, the aim of medicine is to prevent disease and prolong life. The ideal of medicine is to eliminate the need of a physician. We haven't really accomplished that, have we? But we need to keep working on it. And then Charlie Mayo, the younger brother, who was the more fun-loving brother, said, the object of all health education is to change the conduct of individual men, women, and children by teaching them to care for their bodies well. And so, of course, the message there is patient education, getting information into the hands of people so they can take care of their own bodies well. And so we're still there. All right. The main things on this slide that I want you to notice are a lot of doctors. So getting all these people to focus on the care of an individual patient and getting all the data that's collected in the right place at the right time has been a focus of ours for a long time. We're a big organization now with 58,000 employees, And those employees have been tremendously helpful for us in developing, doing the research and understanding what the needs of people are with regard to information. And of course, 1 million patients. I want to quickly run through this wheel, which is a model of healthcare, starting with the traditional model of healthcare. And I think you all would say, oh, that looks familiar to me. We start with primary care, the first point of contact. We all know this is an important piece of the evolving healthcare model, the quarterback of a person's healthcare. Secondary care, which has disappeared almost entirely from the medical landscape, but I guarantee you will be back soon to help us out. Tertiary care, which is this specialized care that we have with all the fancy scans and surgeries and medications that we have. And quaternary care, which is sort of a new term that we use, where there are a few medical centers in the country where you can go to get gene therapy or to get a transplant, an organ transplant. And what I want to talk about is what in the last 10 years we've been working on to say, well, what are the new care models and where do they fit into this whole process? And so we can look at home care and we realize that most health decisions are not made in the doctor's office. Those health decisions are made outside the doctor's office by people, over 100 a year in a study that was done 20 years ago. And people need to have the information at hand, at home, when they're making these decisions. So this is a very important area. I have an icon for retail clinics, but that could be worksite-based clinics. How do we deliver health care very close to the point of need, if not at the point of need? Telemedicine, which is one of these tools, fairly amorphous. We've actually been working in the telemedicine space for 30 or 40 years, and we've discovered that it's useful and usable in virtually all those areas of medicine. And in fact, it's helping us with this home care even before the person gets to the doctor. We can gather a lot of important information and make some medical decisions based on that. And then finally, e-consults, which is the link to the secondary care medicine. Secondary care medicine is at least as a mentor in medical school told me, it's the practice of specialty medicine in a power outage. So how do I use the brain of the specialist but not use all of the fancy scans and extensive blood tests and all of those sorts of things? And so with e-consults, I'm seeing more and more that we're tapping into the specialty expertise. Me as a generalist, and I can tap into the specialty expertise of a specialist, but not have to send them either to the specialist's office or get a bunch of fancy studies done. And then really close to home for this conference is these new tools that we've got that are really revolutionizing that, especially the mobile tools and the whole conference here, figuring out those ways that we can gather information from people, that we can biomonitor people, and that we can deliver information to people to help them be healthier. Remote monitoring is something that we use a lot. We have scientists who've developed a postage stamp size cardiac monitor that we can put on people with rhythm problems and monitor their heart rate for a month or 3 months or a year because they may be having infrequent events. That's huge. But that same technology, as you've seen in the conference here today, the ability to watch those heartbeats may also have implications for me and my health program or my wellness program. So all of these are really empowering this evolution that I'd like to talk a little bit more today. So today's health landscape, no surprises to anybody. Costs are going through the roof. They're not sustainable. The prevalence of diseases are increasing because we're living longer. We're living longer, and that's a good thing. But we now have people, and I have patients who are 90 years old with 10 medical conditions on 15 medications. All of a sudden, it's become very complex. We know that perhaps for good reasons, with the Accountable Care Act, there will be an increased demand for care. We hope that'll be primary care, and we hope that it'll be preventive care so that we're not dumping more and more people into this catastrophic care business. But it's putting it's a little stress on the healthcare system. The aging population, again, that's a good thing, but again, it's loading or overloading the healthcare system. And then finally, with healthcare reform and legislation, we all of us in this room have to sit down and figure out how to make this work in the next 15, 20 years, because if we don't, we'll be in the middle of a crisis. Again, talking about some of the changes that are facing us and some of the things that are driving us through this process. We know that we're spending 18% of GDP or thereabouts on healthcare, by far and away the biggest industry in the country. And unfortunately, that's rapidly headed toward 21%, and so we've got to change things. These tools that we want to talk to you about today are evolving delivery channels, and we use all of them, and we want to use all of them more to reach our patients in the clinic, as I'll talk about, but also, importantly, outside the clinic. So right now, Mayo has 3 practices. When I started my training at Mayo 30-some years ago, we had 1 clinic in Rochester, Minnesota. Big clinic, 2,500 physicians. But we now have 3 big clinics, 1 in Scottsdale, Arizona, 1 in Jacksonville, Florida, and 1 in Rochester, Minnesota. And over the last 20 years, those 2 other clinics have 500 to 600 physicians, and they have most specialties represented. We have had to figure out how we integrate all that data, because the last 20 years has largely been digital, among our clinics. And then we also have about 80 small clinics, 1 or 2 physician clinics, 100 physician clinics, and we need to figure out how to make all of them work together. So that process of integration, making smart people work together around the care of a patient, is continuing. So what I just talked about is really the here, but our CEO has challenged us to look at the there and the everywhere part of the equation. So we work every day with practices large and small that are not Mayo Clinic practices, and we don't have integrated medical records with those practices, yet we still need to figure out how to serve the needs of those patients who don't necessarily want to come all the way to Rochester, Minnesota or Scottsdale, Arizona and see a Mayo Clinic physician. And so we're working on integrating with physicians in other clinics and working across platforms. And then finally, in the everywhere world, how do we reach out to consumers, whether those are individual consumers who can use good information, good tools, integration of all of their own personal health information into one place so that they can be healthier. Or if you're an employer and you know that it's cost effective to keep your employees healthy and at work and productive, and believe me, the costs of people being either at work but sick or away from work even exceed the high medical costs that are there. And so we want to reach out to all of these different groups. Again, our CEO has challenged us to work differently, to reach out, to know what our core competencies are, which are largely gathering medical information, making medical judgments, and taking care of people in a clinical sense, but to work with other partners who have expertise in other areas. And so that's what I want to talk about today, which is this using digital solutions to reach out to all of these different audiences. And Apple put together a nice little a summary of some of the things that we're doing in this space for the doctors and the physicians. And I'd like to play that for you now because they say it more eloquently than I can. And so if we could play that video, it's about 3 minutes long, but it's a kind of a capsule summary of
Mayo Clinic is
Mayo.
a healthcare organization focused on patient care excellence, research, and education.
60,000 people come to work here with a common purpose, and that is to meet the needs of the patient. Mayo Clinic is really a model of what healthcare could be.
In the world of trying to be more efficient and providing the best care, the iPhone and the iPad have definitely given us a vision of where we can go in the future.
Mayo Clinic is a not-for-profit humanitarian healthcare organization that has built up over nearly 150 years. We had the development of the heart-lung machine, the first total hip replacement, the first place to have a CAT scanner on site, innovation, technology, science and medicine working together. Doctors, nurses, other care providers are very mobile, but we still need access to organize information to help patients get better care.
When we changed to an electronic medical record, it was very problematic. The information was coming from multiple different sources, and it required logging on to multiple different applications within a computer. Physicians felt like they were interacting with computers more than they were interacting with patients. Mayo Clinic developed an application in-house called Synthesis Mobile, which synthesizes patient data from innumerable different sources and makes it readily available on iPhone or iPad. Imaging, laboratory studies, medications, really any data that we collect on a patient is available on Synthesis Mobile. Now I can sit with a patient, have an eye-to-eye conversation, and show them their CAT scan or a video about what the options are. I can use synthesis to change an IV setting for a patient in the hospital, and I can charge capture or do order entry from within the application. There's no question that I'm faster in taking care of patients, and there's never a time that you're away from critical information.
We also developed a Mayo Clinic patient app. If you're a Mayo Clinic patient, you can log in with a secure encrypted password and have access anywhere in the world to your medical record. It also provides secure messaging, and we can now provide monitoring capabilities to patients in the home. And Mayo Clinic has a vision of having a meaningful relationship with over 200 million patients. The iPhone and the iPad are going to help us get there.
This technology is enabling communication. We're now able to see doctors and nurses and patients in real time sharing information that literally just became available to them minutes before.
Our number one concern is the security of our patient's medical record and content. iOS provided the security we were looking for and the ability to write applications that leave no trace or data on that device that we would consider confidential. We have iOS devices all over Mayo Clinic, from nurses to helicopter pilots to ambulance drivers to physicians meeting with patients. It makes everybody more efficient. The iPhone and the iPad bring to us a level of technology that didn't exist in the past.
It really brings us back to when healthcare was a personal interaction between the physician and the patient.
The question is, how do we stay connected with people? How are we there for them when they need us? With this technology, we can be more accurate and more complete, which means better outcomes, safer care, and that's, I think, is really quite extraordinary. This is a very exciting time to be in medicine.
All right, thanks. If we could have the slides back up. I'm going to move pretty quickly through some of these other slides here. But I use that synthesis program every day in my practice and with my patients, and my patients increasingly are using their mobile access to their medical record. In fact, I saw a patient last week. I've for years tried to practice this shared decision-making model in which I try to give the patient all the information so that we can come to the right conclusion for them. And so when they come into the office, I give them a copy of my note that I had for them the last time we talked. And I was starting to hand it to the patient. He pulled out his iPad and he said, "I don't need it, I've already read it." And so people really are using that information, and they're using it to take care of their own health. We saw most of these things in the video, so I won't spend much time on them. But there are already apps out there that people are using, for instance, in pregnancy, for dealing with chronic conditions, and for self-care with things like anxiety or meditation. So those have been validated clinically, but we can put them out there and people are using them every day. We think the e-health care delivery platform is something that's on the rapid growth phase with our patients, especially in these areas. So the e-consult area is something that I use every week in my practice, accessing my own specialty colleagues, but also that these affiliated practice networks use so that they can get a consultation. Hematology and oncology is the area that's using it the most in terms of volume. Neurology is probably next. The thing that's nearest and dearest to my heart is the concept of wellness. We think that wellness is a way of tying together all of these important aspects of health, whether it's population-based health or chronic disease management or acute care being when the patient is at our facility. But we need to put a wrapper of wellness around this, and we think that the digital environment is the right environment in which to do that. And then we can deliver that here, there, and everywhere. And we can tie together all of these people who contribute to the health model, and they can use that information in a helpful way. Well, this is why wellness is important. No surprise to anybody. The top 10 causes of death in the United States, those 10 causes cause 75% of the mortality, and about 75 to 80% of those are preventable. So wellness clearly is important. And as we heard a little earlier in the conference, if you look at the last 4 of the last 6 conditions on that screen there, those are conditions of aging primarily. So those are on the rapid growth phase. So they're just going to keep ratcheting up the list of 10 most common or expensive conditions in the country. We think wellness has a place both for individuals and organizations, and we think that we need to serve up things to both of those. We are in this rapid development phase of everything in life, and we try to apply that in the information area as well. How does wellness differ from diseases? Well, this is some of the area where, with our own employees, we have worked on developing wellness tools for them so that they can stay healthy, or if they have a chronic condition, they can manage it better. We are developing a healthy living program, which is based on a wellness center that we built for our employees in 2007. And we've been experimenting to see what works and what doesn't work and what the best context is to get people to change behaviors, and are developing a personalized wellness intervention for the general public now, which will take place in its own building, and which we think will foster that wellness journey for people. Timeline, again, we really can go back to 1996, where we started to try to deliver information on our first website at the Mayo Clinic, and a big evolution over time to this very exciting time in 2013, where we're really looking at the next generation in digital wellness from Mayo Clinic, and have turned to our partners at Everyday Health to help us take the medical content and the tools and deliver it in an engaging and effective way to patients and the public.
Thank you, Doctor. Hello, my name is Mark Roberts. I'm the general manager of the Health Solutions Group for Everyday Health. And what my role is at Everyday Health is to take all the consumer-facing platforms that we've made over the past 10 years and make them available for the payer market. And that means employers and insurers and other providers. As Dr. Hagen explained, Mayo Clinic has 120 years of experience provided integrated medicine. They're on the leading edge of all sorts of innovation. They're building a physical laboratory of wellness to test their wellness model. They've got the clinical part nailed. And where Everyday Health comes in is around providing digital solutions for consumer engagement. Everyday Health touches 42 million people every month through our websites, everydayhealth.com, and through some of the other partner sites we operate, sites like What to Expect When You're Expecting, the pregnancy site, the South Beach Diet, the diet site, Jillian Michaels, the fitness site. And we're taking that digital platform and now making it available to payers. If you can put the slides back up, I can walk you through an example of what we're doing.
If you just go back to that same slide deck that I was using, we'll be at the right place.
What's that?
Yes.
Yes, of course.
Or take questions, yeah.
So the approach that we're taking to wellness is how do we take the tools that we're using in other places and make them appropriate for the wellness space. And we're doing that through 3 different areas of engagement. The first area is around personalized advice. So we start with the health assessment, and this is a Mayo Clinic provided clinical expertise, but wrapped in Everyday Health user experience. And we allow them to enter information both on a survey basis and also do biometric upload to get additional information. All of that data is synthesized into a detailed results page. And this result page not only tells you how you're doing against the recommended values and how you're doing against previous years, but it also gives you a detailed action plan on how to make changes in your behaviors to be able to improve that moving forward. One of the things that Mayo Clinic has done remarkably well is created this integrated approach to medicine where there's a team of experts that are helping you. And we're replicating that through the 6 areas of wellness that are outlined with specific clinical experts in each area. So you really understand that there's a team that's supporting you. All of those 6 building blocks of wellness, weight loss, nutrition, stress management, sleep, resiliency, physical activity, all of those plans are actually rolled up into a single plan that's integrated to help you through your health journey. And it's not just the plans and the tools that are optimized and configured to you, but also the content as well. One of the things at Everyday Health that we've done that we were really successful at is machine learning to use an algorithm to try to figure out what's the most appropriate piece of content to serve for an individual based on the conditions that they've told us about, based on their demographics, and based on their previous click history. And we're using that same algorithm to power the content that we put up on the Healthy Living program with Mayo Clinic. Our second philosophy around driving consumer engagement is around keeping technology simple, whether it be a decision to support tool. In the instance here, I was under stress, and it's trying to figure out perhaps sleep is the reason I'm under stress. I have a 9-month-old son, so I can promise you that sleep is the reason that I have a lot of stress. But in addition to that, not only do you have the decision support tools to help you think through the problem, but you also get actionable advice, so you know what to do next. And again, that advice is coming from the expertise of Mayo Clinic. One of the areas that we know a lot of people want to be able to manage their health is around diet and weight loss. So we've spent a lot of time in our food and fitness platform. This is an example of individuals that are selecting recipes. It's organized by favorites or any other way you want to filter. In this instance, I've selected the turkey meatloaf, and I get a simple recipe and then can quickly, with one click of the button, add it to my food journal. There's no math required. That's done automatically. And the same thing happens around exercise. So you simply get an exercise, a functional motion that the Mayo Clinic experts recommended, and then with a click of the button, you add it to your journal. Better still, we've integrated with all the open APIs. So if you're using a tracking device from Fitbit or Body Media or a GPS device from MapMyFitness, all of that information can be pulled into the system seamlessly. Speaking of tracking, we believe, as I know many of you do, if you can't measure something, you can't manage it. So we have a series of trackers to allow people to manage their health. And then lastly, while you may want to eat your turkey meatloaf at your desk, you don't have to, because we've actually made it so the responsive design, you can access all of the tools and services from any device. The final philosophy that we have around engagement is driving motivation and making sure that people stick with the programs. Before taking over this health solutions role, I ran marketing for Everyday Health. And we used to talk about diet season. It started the day after Christmas, and it ran, if we were lucky, to Valentine's Day. And we recognize that health happens beyond February 14th. So how do you keep people motivated? And we do that with challenges. This is an example of a challenge that we're running currently within Everyday Health for our own employees. We have 85% participation rate. And we've architected the challenge such that the goal is to get your inactive coworker to get moving. So the way that you win the raffles and the way that you win your rewards is to have your entire team get to 10,000 steps a day. But you don't just need to reward and incent activities. You can also reward and incent anything that's trackable. So in this instance where I have an elevated cholesterol level, I'll be rewarded 30 points for watching a video about how to manage my cholesterol. And then finally, going back to this marketing message. So I've spent $100 million marketing Jillian Michaels and South Beach Diet over time. And when we do that, we spend a lot of time thinking about the messaging. We think about the unique selling proposition. We think about the registration flow. We think about how do we keep the person engaged. In those instances, I was trying to get an individual to pull out their credit card and pay for the service. But we can use those same direct response marketing techniques even if they're not paying for it themselves, even if the payer is coming from their employer or from another message. So here's a simple example of an individual who may be trying, how do you get an HR benefits coordinator to get his population to engage in a weight loss program? Is it a feel healthy message? Is it a habits that could be sabotaging your weight loss message? Is it a message around all the great foods that you can eat? Or is it a weight loss claim? And the answer is, it depends. It depends on the population, and only if you use direct response discipline are you going to be able to know that answer. So in summary, we're really excited about the opportunity to pair Mayo Clinic's clinical expertise and Everyday Health's 10 years of consumer engagement and do it in a way that we can make this information and these tools and services available to consumers and to the payer population. So I'm excited for us to be able to drive more engagement and believe that that engagement will drive better outcomes.
Thanks, Mark. I'll just end with a brief glimpse again of this composite, because we believe that the secret lies in the integration of all of these things, whether it's a patient coming to me for a face-to-face encounter, or whether it's somebody out on their own putting together their own wellness plan, or taking their personal health record and taking that information from one doctor to the next doctor. Integration's the key, so that's what we are shooting for. We have a few minutes here. I know it's the end of the day, but if anyone has questions, we'd be happy to take some questions from the audience.
Dr. Hagen?
Yeah.
Hi. Thank you so much for your presentation, Mark. Thank you as well. Your model of team-based integrated care at Mayo is so well regarded and well renowned. What are the barriers that other institutions perceive in giving the same type of team-based integrated care that seems to make so much sense, and as we talk about being patient-centered, really exemplifies and puts into action that concept?
Yeah. I think that if people simply use that conceptual model of the care centered on the patient, whether you have a large multi-specialty clinic and therefore you can integrate it reasonably well, or whether you're a cardiology clinic and an orthopedic clinic working with a community-based primary care practitioner, it's figuring out how to make the pieces fit together. It's figuring out how to make the medical data live nicely together in a record that's transportable. So I think that it really, I see the movement and have seen the movement over the last 5 to 10 years toward this integration. And as a clinician, meaningful use, I don't know if any of you have heard of that, but that's one of the efforts being carried out by the government to try to push us as clinicians to work better together at a digital level. So can we make that information standardized enough and transportable enough and collatable enough so that it's useful no matter where the person is getting their medical care? So it's happening incrementally. And I guess the big question is it going to happen fast enough for us really to realize some cost savings from that?
Thank you. Yes. There you go.
Chris Bro, U-Metrics. Thanks so much for that presentation. I wanted to ask a question. I think I know the answer, but I want to ask you because you've got more experience with this than I do. Can you talk more about physician reaction to the deployment of iPads in your institution? We're told that 60% of physicians in the U.S. use iPads, and many of them bring them to their place of work and use them there. What was the range of reactions, and just give me your personal experience about it. It's really important.
Yeah, just anecdotally, and what I've seen in myself and in my colleagues, when we implemented the electronic medical record, we really went to the clinicians and said, thou shalt use this, and you use it in this way. And there was a lot of resistance to that because it didn't make me faster, better, more efficient, whatever. And what I saw with the introduction of the Synthesis Mobile and the ability for me to use it on, I happen to use an iPad mini, but to use it on that platform, which was convenient for me and actually did make me a little faster, that was much more quickly accepted. So I think that the key to it is to if it makes me faster, better, smarter, then I'll use it. And if it doesn't, I'm going to come kicking and screaming.
Thanks very much.
Mm-hmm.
Is there any last minute quick questions or you guys want to talk to him outside? Okay. I want to thank you both. It was great to have you both participate in this.